So I think Kelly is going to have a few PT problems. I have them listed out here. First, I think she's going to have bone density issues, decreased bone density, because she hasn't been weight bearing at all. And she's been in bed mostly for 4 weeks as far as we know. So I think that's going to be an issue. I also think that she might have decreased endurance because she hasn't really been moving around or doing anything. And she was previously, before the accident, pretty active, and she had a very physical job. So I think that might affect her a lot. And I think she will have decreased range of motion just in general in her whole body, because she's kind of been laying in bed and hasn't been utilizing the full range of all her joints. Also, there are restrictions on a few of her joints as far as the range of motion goes, that she can't go past 90 for a few things. I also think that she's going to have decreased strength, of course, because she hasn't been using her muscles at all, so they're going to atrophy because she's been in bed rest. There could also be muscle shortening, like contractures, kind of a combination of the two, because she hasn't been moving around much. She could be at risk for a knee or hip flexion contracture. I also think she's going to have some psychological impairments because of how young she is. She lives alone. She doesn't have a lot of family support, and she's been isolated for 4 weeks. So I think that might be an issue for her. Also, she previously was a user of smoking and alcohol and marijuana, so that might affect her as well. And I also believe that she'll have some functional mobility deficits because she can't weight bear on the whole right side of her body. So she is probably going to have a lot of limitations with that. I also think she's going to have difficulty breathing due to her rib fractures. We're going to have to educate her on breathing techniques and things like that. And then finally, I think that she's going to have a pain management is going to be an issue with her because she's very focused on her pain. And she should be, because she's in a lot of pain as well. You know, all of her limbs are affected in some way. So that is probably going to be the limiting factor for things that she is willing to do based on the joints that don't have precautions on them. So I think that's going to be a big problem as well.